Good afternoon, the viewers. My name is Dr. Ashok Hande. I'm a neurosurgeon in Fortis Hiranandani Hospital, New Mumbai. Today is the World Brain Tumour Day. Today we are going to talk about the cognitive dysfunction in case where there is a dysfunction of the brain because of brain tumor affected. That means any delicate moments, say like interpersonal relationship, or talking relevantly to a different person, or assimilation of thought, the emotional outburst, the emotional control, most of this function, they come from these parts of the brain, mainly frontal and temporal brain. Now, to give an example, if the person has a tumor in the left temporal brain, we say that speech is affected. Now, the speech has got three parts. All the three parts of the speech function, that is talking, analyzing the function and replying in yes or no, is concentrated in the left part of the temporal brain. There is a dominant hemisphere. So if my left temporal brain is affected by any means, say for example by the brain tumor, my speech will be affected either mildly, severely, and we completely lost. Same thing happens in the frontal part of the brain. If the frontal tumor affects a person, then obviously his emotional experiences, the way he speaks with the people, all these arithmetic functions, the calculations, everything will be affected. And these are the most important part of the function of the brain, which the person deals with in everyday life. Now, when such tumor occurs, which are affecting a dominant part of the brain, then obviously majority of the tumor, they have to undergo surgery. The reason to do surgery is one, that you remove the tumor. Number two, you come to know what is the type of the tumor. So further treatment can be planned accordingly. If the tumor is benign, that is non-cancerous, then obviously complete tumor removal is the only answer and it's a cure for the particular patient. But if the tumor turns out to be a malignant one, obviously depending on the grade of the tumor, the further treatment needs to be taken. And the further treatment is in the form of either chemotherapy or radiotherapy. Now, when we operate on such tumors which are located in the dominant part of the brain, a lot of other things are taking priority over the routine investigation. So what we do in such cases, we do what's called the functional MRI and the DTI studies. By doing this functional DTI studies on the MRI, we come to exactly what is the location of the speech center inside the brain. That is number one. Number two, during surgery, such surgery are done under awake anesthesia, in the sense that when tumor is being removed, the patient completely awake so that his functions are not disturbed during the surgery. Some people also do what is called as intraoperative motor function monitoring or corticograms or cortical studies, where again you stay away from the functional areas of the brain while removing the tumor. And we also sometimes do what is called dye study, where during surgery a special dye is injected intravenously, which can lighten up the tumor. Now, this is called as a ICG fluoroscopy or any other fluoroscopy by which the tumor delineation is done during surgery. And we can take help of many other modalities, say like intraoperative ultrasound, intraoperative QSARs. All these gadgets are used basically to make the surgery safer for the particular patient. The goal of such surgery, whether it's a benign or a malignant, is complete tumor removal. Yeah, in benign cases, it's a cure. In malignant cases, it is very easy for radiation oncologists or chemo-oncologists to manage such cases if the residue is as small as possible.